Would you like your teeth to be whiter? Most people answer that question positively. Are there any negatives? Can teeth be over-whitened or over-bleached? Is it painful? Does it take a long time? How do you do it? Is it expensive? Are there some alternatives to chemical whitening of teeth? Is it permanent? All of these questions will be answered in this video. And a combination of bleaching or whitening and tooth-colored restorations can really change your appearance and self-esteem. Look at this patient. Are there some risks or negatives to whitening of teeth? I've personally been whitening teeth for several decades, and I can contend that there are almost no risks. To date, millions of teeth around the world have been whitened. No negative effects have really been reported in the literature if it's carried out properly. But teeth can be whitened too much, making matching colors difficult when doing fillings or caps later. A good suggestion that some dentists may or may not agree with is if we exceed whiteness beyond the color of the whites of your eyes, it can look a little false, so be careful you don't get too white. Sometimes during the whitening procedure, teeth become a little sensitive, but this effect usually goes away within a few days after the whitening is finished and is not a major problem. So, are there risks? Are there negatives? Not very many, and your dentist will discuss them with you. Some teeth respond very well to whitening, while others don't. Your dentist or your dental hygienist can tell you if your teeth can be lightened. You're observing a dead tooth with root canal therapy. Whitening is only occasionally successful and the color tends to come back, but sometimes it's okay. Discoloration caused by medications in childhood can often be removed well, but sometimes they can't. Overuse of fluoride during tooth development can present challenges, but can be aided by whitening. Darkly stained teeth may or may not respond to whitening. But now for the good news. The so-called stains of age accumulated naturally throughout life by eating and drinking colored foods, such as coffee or tea or hot chocolate or any pigmented substance you can imagine, can be removed easily. Smoking is also a major cause of tooth discoloration. This patient has the stains of age. Observe how much color has been removed from the lower teeth. The upper teeth were not bleached. The badly broken down upper teeth will receive caps that will match the color of the bleached lower teeth. Fortunately, many of us have only the stains of age, and the stains can be easily removed. Ask your dentist or dental hygienist if the discolorations in your teeth can be removed easily. What are the alternatives to whitening? Whitening is the least expensive and most conservative. Your dentist will tell you what alternatives to whitening are available to your specific situation. The following are typical alternatives. Do your teeth really need to be lightened? If not, don't do anything. You may be okay as you are now. Veneers, crowns, or caps. These teeth would be very difficult to bleach. The discolored tooth structure must be removed and either crowns, or you call them caps, or veneers placed. The final excellent result was achieved by crowns, but the cost difference is significant. Crowns or caps cost many times more than whitening, but they can also correct decay, misshapen, darkly stained, or malpositioned teeth. Crowns of metal or ceramic or the more conservative veneers have one significant disadvantage. The external portion of the teeth must be removed to allow space for the crown or the veneer. The patient's upper teeth have old, worn-out crowns on them. They're metal or they're ceramic. They were removed. A model of the teeth with the crowns removed. Note the small size of the prepared teeth that have been trimmed down. The crowns as delivered from the dental laboratory, and the happy patient with the new crowns on all of her teeth. Veneers require removal of only the front portion of the affected teeth, as you see in this drawing of the cross section of an upper front tooth. As you observe the patient before and after, the 3 veneers placed really made a significant improvement in the previously unsightly teeth. Veneers or crowns are excellent, but relatively expensive alternatives for tooth whitening. This highly successful and widely used technique is by far the most popular one in dentistry. A flexible tray is custom made for your mouth. After adequate instruction by the dental staff, you are given hydrogen peroxide to take home with you. You place the peroxide in the custom trays each day for various times as directed by your dentist or hygienist for a suggested time period. The stain removal from your teeth is monitored by the dental staff to avoid any unwanted effects. Several days later, you have whiter teeth. The advantages of at-home whitening are you're in control. With the dental staff observations, you whiten your teeth to the desired and pre-planned color. The result of at-home bleaching is well proven and effective. Slight tooth sensitivity may persist for just a few days after the whitening procedure, but the result is, for you, whiter teeth. Some of you will prefer to have the dentist or the dental staff supervise the whitening of your teeth and have it finished in the dental office rather than at home. In-office whitening uses higher concentrations of hydrogen peroxide than at-home whitening procedures, although both are supervised by the dental staff. Some dentists use a light to assist in bleaching, while others do not. The only advantage for in-office whitening is that it is accomplished faster than doing the same thing at home. The only disadvantage is that occasionally, because of the fast pace of in-office, tooth sensitivity persists for a few days after the whitening is completed. The dental staff can easily apply concentrated desensitizing agents to the sensitive teeth and get rid of that sensitivity fast. The cost of in-office and at-home whitening is usually very similar. Your local grocery store or pharmacy has many varieties of non-dentist applied whitening products, some of which your dentist may recommend for certain situations. Please ask your dentist or dental hygienist if these products are appropriate for your teeth. In general, these products are not as effective or predictable as professionally supervised techniques. However, if you're planning to whiten your teeth with one of these over-the-counter pharmacy grocery store products, please get advice from your dentist or dental hygienist on how to use them, because whitening restored teeth without dental supervision can force you to redo some of your fillings and crowns. Because of the color of the teeth, they no longer match those fillings or crowns. Be careful. The advantages of over-the-counter whitening products is lower cost and the convenience of getting them in consumer stores. Many toothpaste ads state that products are whitening toothpaste. Don't expect much whitening effect from these toothpastes. The disadvantage of over-the-counter is very clear. You do not have the predictability about the extent of the whitening or professional supervision during the whitening procedure, unless you ask for it from your dentist or hygienist. Some of the consumer brands whiten only a few teeth and not the entire mouth. In other words, ask your dentist or dental hygienist about these over-the-counter products. You may or may not want to use them. Research around the world has shown that some of the color returns to whitened teeth within just a few days after completing the tooth whitening procedure. However, the tooth color stabilizes a couple of weeks after completion of this whitening and then only slowly progresses toward a darker color. You'll probably require another whitening procedure within a year or two. Ask your dentist or hygienist about how stable they think your tooth whitening procedure will be. Whitening or bleaching teeth is almost universally desirable to dental patients and accepted so well around the world. It's easy, relatively painless, fast, not excessively expensive, and it will improve your appearance and your self-esteem. If you're in need of some fillings, crowns, or veneers, whitening should be done before the other procedures are initiated. Be sure to ask your dental team about the possibility for whitening your teeth and the method they would suggest for your specific situation.